Good afternoon, everyone, and welcome back to another fresh episode of the Real Talk Show. With us today on the show, we have Sarah, adolescent focal point person, and Monida, a national trainer in adolescent health. On today's show, we are diving right deep into the topic understanding STI signs and symptoms and treatment, second edition. I'm sure last week you had a very informative and insightful show. Well, today we are here to dive in and have a deeper understanding of and continue the conversation we started last week. So, oh, sorry, forgive me, I forgot to introduce our sign language interpreter, Memory Zulu. Um, so just to start up the conversation, would like to first understand, people could get certain things and think, no, it's not an STI. So I've heard people that have had assumed they have a UTI, but when it's an STI. So Sarah, could you please explain to us what the difference between an STI and a UTI is?
Good afternoon. Thank you for having me on this platform. And I will say the differences which are there between the STIs and the UTI. So I'll start with STIs. These are sexual transmitted diseases, which are primarily spread through sexual contact, and they are caused by either a bacteria, virus, or a parasite. And these diseases can be prevented by abstinence, condomizing, even PrEP. And I'll now go to UTI. UTI, these are the urinary tract infections. These are infections which affect the urinary system. And in the urinary system, you'll find the bladder, kidneys, the urethra, and also the ureters. And these diseases are caused by the bacteria. And you can prevent them by good hygiene, not holding the urine when you feel the urge to urinate, and also taking a lot of fluids or hydration. That's in simplest way I can describe them or narrate the differences. I thank you.
Thank you so much, Sarah. That was very clear. I'm sure to have learned something from that definition. Monida, could you give us your definition of what you understand by STI, such as gonorrhea, syphilis, and HIV? Just to be precise, on these three STIs, gonorrhea, syphilis, and HIV, like a definition of what they are. Sorry to cut you short, Monida. I just realized your mic is still muted. I don't know if people can hear you.
Oh, sorry. Okay, I'll start.
Okay.
So, gonorrhea is a sexually transmitted infection that is caused by a bacteria called Bacterium Neisseria gonorrhoeae. This one comes in when one has sexual contact with an infected person. Of course, when you sleep, when you don't use a condom and protected sex. And then syphilis is the sexually transmitted infection that comes in the same way when you have contact with someone who is infected. It's caused by a bacteria called Treponema pallidum. And then HIV, human immune deficiency virus, is a sexually transmitted infection, the disease that comes in when you also have sexual contact with an infected person.
Right, thank you so much. So Sarah, could you please talk about or speak to the specific signs and symptoms of the infections Monida just defined for us? That's gonorrhea, syphilis, and HIV. So I think we lost Sarah. She keeps dropping off. So Monita, could you please talk about the signs and symptoms that people should be aware of for the diseases you just defined?
Okay, so gonorrhea, syphilis, they've got the common symptoms and signs that we know. One will have the burning sensation during and after urinating. One will have the urge to urinate more even when the bladder is empty. And then after urination, a male or a female will notice some pus coming out of the private part, of course, which is the foul-smelling discharge because of the bacteria that is inside. And then there's some swelling on the private parts. It can be a vagina or the penis. That one will have, for a man, the testes will be swollen. For a lady, even the labias, they get swollen. I think those are, and then for HIV, since it deals with, it destroys the immunity, anything can come in, such as maybe someone will present with a certain type of rash, maybe episodes will come in, some diarrhea, some will come with a cough. Yes.
Okay, so before we dive into understanding the stages of syphilis, I also wanted to ask a question. So how can people get to know when they have those symptoms that you just mentioned? How can they get to know to say this is gonorrhea, this is syphilis? Is there a distinctive kind of differentiation that you can tell us about?
Okay, so for gonorrhea and syphilis, of course, they've got almost the same signs and symptoms, but for syphilis, there's one distinctive sign. That's a chunk. It comes out like a pimple on a private part. On the point of entry, for example, if this woman had a lesion or maybe a sore on a private part, and then they have unprotected coitus or sex with someone who is infected, the chunk, the sore-like thing will come out on the same exact spot where the infection entered from. So for syphilis and gonorrhea, I think a chunk would differentiate the two. Otherwise, the other symptoms like discharge, painful urination, they are common. But a pimple like ulcer will be able to tell us that maybe this thing is it's a syphilis or gonorrhea. For HIV, like I said, since the immunity is compromised, someone may come in with anything that maybe rash or any other immunocompromised condition that will help us know. For example, epizoster. If you see epizoster, sometimes we say maybe let's try to test for HIV because we know that the immunity of this person is compromised. And in most cases, you find that it comes out positive.
Oh, okay, great. I see. So now that we've talked about we've understood the signs and the symptoms and the different definitions of these conditions. Sarah, could you please speak to the stages of syphilis and recommended treatment for each stage of syphilis?
Thank you so much. So syphilis has 4 main stages when someone has contracted the bacteria. The first stage is the primary stage. So the primary stage is what Juanita was talking about, where this person will just come and present with a pimple-like thing on the body where there was entry of syphilis. Mainly, it will be on the genitals. So this chancre will be painless, and someone can even ignore it. That is the first stage. And when we talk about treatment, this client, when he or she has come with that presentation, the treatment will be given to them. It's the antibiotics, which is the penicillins, of course. And if this person is not treated at this stage, the syphilis will go to stage 2, which is the secondary stage. On the secondary stage, this person will appear with a rash on the body and on the mucosa membrane. I think well, when it comes to the syphilis, we've seen posters even in the clinics on these stages. So the rash will even be generalized rash, which will be on the back, even on the hands, like generalized body pain. That is the second stage, which is secondary. Then from there, it will go on in latent stage. These signs which have appeared in the primary stage and in the uh, secondary stage, it will disappear, but someone will be infected and the bacteria will be in the body. They will be, it will disappear and the client may appear okay, no any complaints. That is the latent stage. Then, if someone wasn't treated in either the primary or secondary stage, you may think you've gotten healed. Meanwhile, the the bacteria are there in your body manifesting. Then, from the latent stage, it will go to tertiary. It's the advanced stage. This advanced stage, that's where now you'll see someone presenting with the organs in the body will be affected, and that is the brain, the heart, and other many organs because the bacteria have invaded those organs. And someone may present with a disorientation. Someone may even, when it comes to the women who are pregnant, if they don't show signs but they have that syphilis in them, they may have the fetuses dying in the body, like they'll have IUFD, which is falling pregnant, then the fetus or the baby inside them is infected with syphilis and has died because they passed it on, either because they were not treated or they didn't know that they have syphilis. Then others will come um, mentally disturbed or in a psychotic stage where they are not aware of what is happening to them. And then when it comes to the heart will be affected, the kidneys will be affected, and that is the final and tertiary stage. And there's also death. Someone can die due to syphilis, which is at tertiary stage. Thank you.
Thank you very much, Sarah. So we have an online audience, and I encourage you guys to send through your questions and your comments in the comment section, and we'll have our specialists answer those questions. So, Beauty Boost says, "Can one get STIs without penetration?" Sarah.
Thank you for that question. As we've discussed, syphilis is a bacteria, and this bacteria definitely can survive even um, w- within we in on a surface. It can survive. So someone can still contract STIs without sexual intercourse. Like when I have syphilis in me, then I use the same needle with someone who doesn't have, I can infect that person. Even maybe contact with some other body fluids which are infected with syphilis, they can be transmitted to you because the bacteria can still penetrate not just on the genitals, but even on other body parts, even on toilet seats. Like someone with syphilis has used a toilet, then it's not cleaned, then you go and sit on it. It can still penetrate and get into the body. So syphilis can get in someone's body even without penetration.
Okay, thank you so much for taking up that comment. We have another comment from Enoch Toka. He says, "Is there any STI which is not curable?" Monida.
Mm, yes, there are STIs like HIV. They are not curable. We just give medication that prevent or reduce the progression of the disease, or to destroy other organs, maybe immunity, to avoid other opportunistic infections to come in. Necessarily, the drugs that we give in HIV don't treat. So the question of, are there STIs that are not curable? Yes, we have.
Oh, okay, great. Joseph Piri says, what are the first signs of HIV and AIDS? Any of you can take up the question.
Okay, so it differs with a person. Different people would present with different signs and symptoms. Like we said, HIV, it's a immune deficiency virus that attacks the immunity of a person. So if someone's immunity is compromised, they are prone to get infections. Maybe someone will come with TB as one of the opportunistic infections. Someone will come with, like the one I said, the zoster, or some generalized rash, like the way Sarah said. Then some will come with, some will even come in stage 4, maybe Kaposi's sarcoma. So it's different with the way someone will present with, but rash, coughing, diarrhea, maybe night sweats, that will lead to TB. Of course, if you do the investigations, you find that maybe they've got TB, and we'll say, no, this one is an opportunistic infection. So yeah, that's what HIV and AIDS signs and symptoms can present with sometimes.
Oh, all right, great. Sarah, do you have anything to add?
Okay, yes, I can add on. So, as we all understand that HIV is a virus that, when not treated, it can cause AIDS. So, in the first place, before someone reaches stage of having AIDS, there'll be these simple things that we may not even take serious, like flu. Someone will maybe present with headache, it will go on it might go on its own, maybe after a month again, a flu or a persistent cough, those. So when the HIV is not treated now, that's when you go to the advanced stage. What Manida was saying, the zoster, the TB, it's because HIV, the virus wasn't treated in the first place. So someone can have HIV and appear okay and normal, not until they will have problems when they reach the AIDS stage.
Oh, okay, great. So we're going to understand definitions of what these various STIs are, and also the signs and symptoms and how they can be gotten. But I would want to understand who is at the highest risk of contracting gonorrhea, syphilis, HIV, or UTIs, and how can they be transmitted. Earlier in the conversation, you did mention a few ways, like when people, like it doesn't, not only, you cannot only get STIs such as syphilis through penetration. Maybe sometimes when you sit in a toilet that wasn't cleaned properly after someone with syphilis used it or something. So could we get a detailed explanation speaking to who is at high risk and also how these STIs can be transmitted? Sarah?
Okay, so when it comes to such diseases, especially the STIs, anyone who is sexually active is at high risk. I'm saying so because the most common way of contracting these STIs is through sexual intercourse. So if someone is sexually active, those are at high risk of contracting the the STIs, and also the lifestyle of someone. If someone is maybe a drug abuser, they use needles. They may not be sexually active, but if they're using drugs, like where you use the same needle, yes, those are at risk. And also some health conditions. There are health conditions which will lower your immunity. Let's say HIV. HIV will lower your immunity, and with that, it's easy for you to have these other STIs. So when it comes to the UTI is very much common in women. As we know, it's because of the way we are made. It's common in women, and when it comes to urination, a lot of women, I think, after urinating, they'll use tissue. The reason why is to make the genital area dry, because if it's not dried, then that remaining urine drops on the pants. The pants will be wet. It will be a media for bacteria. Then the bacteria will easily go in the urinary tract and affect. So for women, it's very much common, and they are at very high risk for the UTI. And also, some certain sexual activities may also contribute to UTI. And as I earlier said, holding on to urine. So those people who like holding urine are at risk of uh, contracting the UTI. And also, the other thing is not taking a lot of water, because when you take a lot of water, that's when urine will be made in the kidneys through the bladder and comes out. So if you don't take a lot of water, one, there will be substances which may form the kidney stones. As a result, you have kidney stones. So we should be taking a lot of water. So those people who are taking less water, they are at risk. Those people who are not practicing good hygiene, especially women, they are at risk for UTI, and also holding on to the urine. I think those are the most people who are at risk of the STIs and the UTI.
Oh, okay. Great. I see. So can we also get an understanding? So now we've spoken about who's at risk and everything else. Why is it important for early detection of these infections to enhance the successful treatment? So, and what available treatment methods are currently there for these various infections? Monida.
So maybe just to add on Sarah's point before I answer mine, douching in women can also contribute to the high risk of them getting UTIs. What I mean is inserting something on your private parts. Women have this habit of inserting different things on the private parts. So you find that maybe someone is inserting something that is not even clean or sterile, they are prone to have these UTIs. And then back to the question that you've asked, the importance of early detection of these STIs is important, because when they are treated, the health impacts, the side effects of them, one will not experience them. Like there we said, syphilis has got those stages whereby the first one will come, it will disappear. The second one, if you don't treat it, it goes into latent stage. And then now when it goes to the waste, by then most of the internal organs are wasted and it's very difficult to treat. I'm sure you've heard of a saying where they say STIs are very stubborn to treat. They are treatable, but they are very stubborn. So if you notice that, because as a person, you'll be able to know that, okay, why am I urinating? Why am I having this age of urinating? It's not normal. Why is this pus coming out of my private part? Why is my private part itching? If you notice any abnormality on your private parts or any other parts that are the contact with these infected things, you rush to the hospital, clinic, or any facility where they can treat you, so that you don't go into the latter stage or maybe the tertiary stage whereby it will be very stubborn. And in this stage, you find that most of the vital organs, such as the heart, the brain, more especially syphilis, it's one culprit that affects these organs. Then it will be too late for you. And then they treat the treatment methods, or how we can know if this person has got these STIs. We first start collecting urine. Like Sarah said, a woman is more prone to have UTIs than a man, because a woman has got a shorter ureter than a man. So a woman is prone to have STIs in the sense that a man will present with, if a man, the obvious signs of a man having STIs when they present with UTI is there. But if a woman presents with a UTI, you find that they don't even have an STI. But if it's a man, because mostly men, when they prevent with maybe pain after urinating or during urinating, when you do the test, you find they've got this STI. Because of the same thing that we said, the shorter and the longer ureter. And then we get urine, we check in the urine if there are bacteria, then it will help us go further. We'll collect blood, which will also help us to diagnose if someone has got an STI or UTI. And then the other way, like we said, the syphilis to prevent with a chunk on the point of entry. So there are some vaginal examination or maybe penile examination whereby we'll be able to know the type of, because the syphilis chunk will be able to see it even physically, be able to tell this is just not a normal rash, it's this. So those are the investigations that we can do. And then the treatment, like she said, we have penicillins and antibiotics that we use for treatment.
All right, great. This is a very interesting topic. I'm getting to learn a lot of things from you guys. I hope our online audience are learning too. So we have a few comments in our comment section. So Rebecca Mulenga says, is a urinary tract infections in connection to STIs? So I guess this question is trying to ask if UTIs are connected to STIs in some type of way. So again, Rebecca Mulenga says, anyone is at high risk. So as long as you are sexually active, so I guess she was contributing to the conversation we had earlier on who is at risk. So could we take up Rebecca's question where she's asking if UTIs have any form of connection to STIs? Sarah.
So definitely UTIs can be connected to STIs because of the presentation and how they come about. Yes, because we said especially in men, like Monida has explained, a lot of men who come presenting with STIs because of the makeup, they may also have the UTI because definitely the bacteria can also invade in the urinary system. Then when it comes to women, we know there are two different passages, but the connection can be there because the bacteria can also invade in the other system. So these two may be present in someone or not.
All right, great. We have other questions in the comment section. So Wupe says, do you test for syphilis just like we do test for HIV and AIDS, or you just tell by looking at the signs of a patient that has brought forth? Monida.
Like I said, the investigation methods are a lot. So the way we test for syphilis, we also collect blood. We can't necessarily just look at the presenting factor, like maybe a chunk. It might be a chunk or maybe it can be a pimple, but for us to be definite, we collect blood. Then we've got some testers and reagents that we use that are going to help us to know that this person has got an STI. Of course, with that thing that we saw, maybe the external part, the chunk or the rash, but we still collect blood to have a definite result. We have the correct result and know this person has got this type of STI.
Okay, so just to add on, so according to MOH guidelines, anyone who comes presenting with STI will test for HIV, and those who test for HIV and according to history they are sexually active also test for syphilis, and we use the rapid where you can know the results within 10 to 15 minutes. So that's the guideline according to MOH.
Okay, great. So as we wind up the show, would also equally like to understand, we've talked about everything, how these diseases come about, how they are transmitted and everything else. But now we're going to take time to talk about the preventative measures that individuals can take to reduce the risk of them contracting these infections. So what are some of the preventative measures that people could take for them to prevent themselves from contracting these infections? Sarah?
Okay, so some of the preventive measures that someone should take to prevent STIs. I'll talk about STIs first, then we'll talk about the UTI later. So for STIs, the most 100% preventive measure is abstinence, because we know that's the sexual when someone is sexually active, that's when they contract. Maybe 90% of people contract the STIs. So abstinence is number one. Then if you cannot abstain, you condomize. You have to use a condom. That's another way of preventing the STIs. Then if you are in a relationship or you have a partner, you have to be faithful to that partner, and that partner should be faithful to you, and you shouldn't have multiple partners. That's another preventive measure. Then we can also use PrEP in cases of HIV. HIV can be prevented by PrEP. That's 90% of prevention rate. It's by HIV, when you take PrEP, it's 90% you can be prevented. So PrEP is also very important when it comes to prevention of HIV, because we discussed that HIV is an STI. So those are some of the preventive measures of the STI. Then when it comes to UTI, as we said, it's a urinary tract infection which is caused by bacteria. And this one, it's also treatable. I think it didn't come out. It's treatable. You can treat with antibiotics. So preventive measure one, hygiene, especially us ladies. Hygiene. We have to at least make sure that we don't put on wet pants. They should be dry. Or if we've washed our pants, let's be ironing them, so that in case there's a bacteria, it can be killed as we are ironing with heat. Then let's take a lot of water. It's one of the preventive measure of UTI. Then urinating frequent. When you feel the urge to urinate, you should urinate. When we keep the urine, it can contribute to the obstruction in the system, the urinary system. Then at the end of the day, we have the UTI. And we should also awareness. I think we should spread the information to other people who are not aware about how we can prevent these things. And when we teach them, let's say we teach them about STIs, we teach them about UTI, they'll be aware of what they're experiencing. And like that, they will maybe go for a test, they will be treated, then we'll reduce the spread. And like that, we're going to prevent these conditions.
All right.
Okay.
So what was you? Okay, go
Wanted
ahead.
to add on. Okay, just to add on the preventive measures, as Sarah was saying, there's also what we call partner notification. This is whereby if someone is treated for syphilis, they need to notify the health workers. There's the way they do it so that we're able to trace that partner. If you're just treated alone and you go back to that same partner who is not treated, you can still reinfect yourself. That there's a saying that people say, no, once you are treated for syphilis, then you can't have it. The reason why we encourage partner notification is that when you are treated alone and you go back to that same person who infected you, you still get the same infection. So partner notification is very, very important as you are dealing with these STIs.
Oh, okay, great. So while we're still on the topic of prevention, we have some comments from the online audience that want to understand certain things. So Eric Malambo says, is it possible for a male to be a carrier of an STI and not show any symptoms and signs? Sarah.
Okay, thank you so much. I think we had discussed last week about this thing. Some of the people who may have the STI may not present with any symptom. So it's very possible, not just a man, even a female can contract this STI and live with it for years without any symptom. And as they are
Okay, it seems like Sarah is having technical challenges. Monija, could you take up the question, please? Or if you have anything to contribute.
Okay. Yes, it's very possible that one will not present with the signs and symptoms. Like for syphilis, we talked about the first stage. A chunk can come in, it goes. The second stage, if you don't treat it, you don't notice it goes. The third stage will not have signs and symptoms. And then it will manifest in the tertiary stage. And this period can even take 10 to 30 years for one to manifest. And mostly when they come in, you find that some will just present with madness. It has already spread to the CNS. So it's very much possible that someone will have an STI even for 30 years. The one that was not treated, they'll still be walking unless it reaches that stage where now the symptoms are or have already damaged. I mean, the bacteria has damaged the vital organs like the brain, the heart, and some other organs in the body. So it's very much possible that one will be moving around even for 30 years without manifesting any signs and symptoms.
All right, great. Sarah, would you like to continue your answer before we go back to comment section?
I think Juanita has finished up my point. I think we are speaking the same language.
Okay, great. We have another question. So are condoms 100% effective for STI prevention? Sarah.
Okay, so condoms are 100% preventive if you use them correctly. So now, when using a condom, you have to check the expiry date. Definitely, if you haven't checked, you use an expired condom, it will not protect you. Then, in terms of opening, there's a procedure on how to open. You don't use your teeth because when you use your teeth, maybe you need to be toned. Then you use it, you say no, condoms are not 100%. So you have to know how to open and you have to know how to use them. They shouldn't burst because when it bursts, you cannot be prevented. So condoms are 100% when you use them correctly.
Just to add
Okay,
on,
great.
just to
Go
add on.
ahead.
So like the way Sarah is saying about condoms, if you don't use them correctly, they'll not be 100%. So the other way that people do, they think when they double use the condom, like you put on 2 condoms, then you are protecting yourself. That one will have a risk of bursting because the rubber will be on a rubber. So the message is that when you want to protect yourself, don't use 2 condoms because other people use 2 condoms thinking they are protecting them. They are making the condom to be 100%. That one you're having a risk of it bursting, meaning you predispose yourself to these infections.
Oh, all right. Thank you so much for those responses. This is a very interesting topic, so the conversation can keep going and going and going, but we are running out of time, so we have to wind up the show. To our online audience, you can keep your comments coming, and the conversation is going to continue in the comment section, and you're going to get feedback on questions and your contributions, so the conversation can continue there. So before we sign out of the show, do you have any takeaway messages that you'd like our listeners to remember about prevention, signs, early detection, treatment, or anything for our online audience? What are your takeaway messages to our online audience? So we can start with Sarah.
Okay, so my key messages to people who are listening. One, regular screening is very important. Let's not wait for for signs and symptoms, if at all we are sexually active and we didn't use a condom correctly. Let's go to any facility and give them that history. That history will make them test you for STIs or UTI. Then again, when we are we've been screened, then if we are found with STI, will be treated. Stigma is not good. It can make someone be demoralized to even go to the facility. But when we go to the facility, let's open up to that health worker we found who is maybe open and ready to listen to us. Let's not hide any signs and symptoms of STIs or UTI. Then when we are found to have STI maybe positive, let's adhere to the treatment so that we reduce the spread of infections. And also, when we get this information, let's spread it to other young people out there who can be helped, because a lot of young people lack knowledge in when it comes to these issues pertaining to reproductive health. So let's share the information and let's encourage them to visit facilities, even just to go and have a talk, or even just if we are not aware on how to use condoms, let's go and learn on how to use condoms. That way, it's going to help us, and we may have STI free in our community.
Monida, what's your takeaway message for our audience?
Okay, so my takeaway message is that when you notice any strange thing on your body, like those signs and symptoms we are saying, don't buy counter drugs. Like maybe you see your friend was given this drug, you go and buy. Like we said, they have different names: syphilis, gonorrhea, maybe UTIs. They've got some drugs that we give distinct in the two. So don't buy a drug because you saw your friend using it and then you go and buy that drug. And then for the adolescents and youths out there, this time around, almost every health facility has got what we call youth-friendly spaces, where you go and meet up with your peers and educate yourselves more on these issues that we've talked about. And you even find peer counselors there in case you're not comfortable to talk to this adult nurse or maybe provider. You can still talk to your peer educator. Those are trained. You're talking about trained peer educators. The government has made it open for every facility to have those youth-friendly spaces. That's why they're even called friendly, so that when you come in, you'll be helped. And you should not just die with that STI. Like we said, some STIs are deadly, like syphilis. When it reaches stage 4, you might not be lucky to be treated. You might even present with madness because it will affect the CNS. If it affects your eyes, you become blind. If it affects your ears, you cannot even, you become deaf because syphilis has got that culprit. And then for untreated STIs, if you just keep for a man or a woman, you might even experience some infertility. Maybe when that time comes, when you want to settle down and have a home, you find that you are unable to have children because you had kept this untreated STI in you. So definitely, if you know that you've noticed any strange thing on your body, do not feel shy. Like I said, the hospitals have been made friendly. If you're an adolescent, a youth, please do not keep that. We are here, we are there. You can please go there. There are people who have been trained how to handle you. Do not keep that STI until it reaches the tertiary stage, which is very deadly. Thank you.
Thank you so much. It has been a great show. We're looking forward to learning more. Like I said earlier to our online audience, we are keeping the conversation going. So you can, if you still have questions, you can send your questions through to you can comment on this exact post and you have feedback on your various questions with relation to the show. Thank you so much for joining us today on the show, guys, to our guests. And to our online audience, see you next week, same time, same place.